Hello, my name is Catherine Mokarfo. I studied at Brandon State University in the Deep MP program. I'm a family nurse practitioner for 15 years, currently working in a local primary care office. My position as a nurse has always been to take care of patients with diabetes. In our primary care office, we see patient a lot of diabetic patients who are non-adherent to treatment regimen often ends up in ED or even hospitalized. So diabetes mellitus is one of the most prevalent and morbid chronic disease. Engelfinger-Jacko 2017. According to FAN 2017 also, there is growing epidemic of microvascular complications such as retinopathy, nephropathy, and neuropathy. Also, there is macrovascular complications such as coronary artery disease, peripheral artery disease, and even limb amputation, FAN 2017. In the face of non-adherent, my patient will be requiring one drop. The patient will need a one drop medication app as a reminder. So I will be discussing with the stakeholders the issues at stake here. My stakeholders for this project are a physician who is my supervisory person and who will be in charge of the logistics. Also, there'll be a nurse practitioner who will be diagnosing and treating the patient. Office manager is overseer for the scheduling and day-to-day running of the clinic in terms of giving out questionnaires, everything that has to do with treatment regimen for these patients. Of course, as a diabetes educator, who now will teach the patients how to use the one drop to ensure adherence. Also, the primary of the main stakeholder here is also the patients and their family, who will now provide them with the support they need to be adherent. The reason for this project is that diabetes is very costly. Healthcare expenditure for diabetes in US 2011 to 7.7 billion, according to David and Ruffline 2016. Direct costs related to non-adherence alone currently equal to 100 to 300 billion annually. Nemo et al. 2017. The total cost of hospitalization due to diabetic-related preventable causes significantly has increased over the year from 5.32 to 6.28 billion over 10 years. Therefore, the importance of educating the stakeholder cannot be overemphasized. At the beginning of school, we were asked to choose a burning issue or a topic of interest for our scholarly project. My pickup question is, in 65 to 80-year-old African American male diabetic patients in primary care clinic, does using of medication reminder app ensure increased compliance compared to those who did not use such app over a period of 3 months? The theorist for my project is Dorothy Oram self-care model. According to NAS 2017, self-care deficit is a grand nursing theory that was developed between 1959 and 2001 and has evolved over the time. It is also referred to as Oram's model for nursing. The theory is phenomenal in that it encourages patients to care for themselves to improve quickly. There are also three aspects of the theory philosophy: universal self-care requisite, developmental self-care requisite, and health deficient self-care requisite. For the purpose of this project, the focus is on health deficient self-care requisite. The conceptual framework is a middle-range theory of self-care of chronic illness where symptoms are clearly integrated with self-care behavior of self-care maintenance, monitoring, and management. Regal et al. 2019. Both theories have common goal of being supportive and educative. Education plan for my stakeholder: the physician will, through informatics, gain knowledge of telehealth, the nuances on diabetic management. The nurse practitioner, as an advanced practice nurse, already licensed and certified, will continue to benefit from periodic updates for her practice. The diabetic educator also will make money. It would have been used for patient hospitalization. She will make money by seeing the patient on an outpatient basis. For the patient and their families, being supportive and being there will not be a lost wage because the patient is being adherent to care. So summarily, if everybody does what needs to be done, if the physician knows what his stake is, the insurance understand the reason why they have to approve things for the patient, because in cost-effective analysis, it is better to pay co-pay than to pay for full hospitalization. For the diabetic educator, she will easily get the feedback because the one drop will upload every patient information direct to everybody to see how the plan is going. And they can be collectively and singly educate by having group sessions, Zoom meetings, telephone calls, all in interest of getting the patient to be where he's supposed to or ought to be, being self-care and be able to manage diabetics so that all the elevated labs, everything with one touch, the technology is very vast. Everybody is carrying the telephone, so that will encourage the patient to adhere to medication. On this note, I think this is a win-win situation for everybody, the stakeholders, the family who will not lose weight, the educators, and the nurse practitioner who could continue to advance in the practice which she is already certified for. Thank you for listening.